Welcome to the PinkpillRx podcast, hosted by Katie and Jay Fillmore, where we navigate complex and thought-provoking topics surrounding women with a focus on education. For shorter form content, follow us on TikTok, Instagram, or YouTube at Caters88 or PinkpillRx.
That's KATORS88.
If you enjoy this podcast, please give us a follow and maybe a nice review.
The system that benefits men is the same one that's breaking them. Introducing How Patriarchy Harms Men, an e-course that unpacks how the same structures that grant men power also isolate them emotionally, distort relationships, and suppress authenticity. This e-course is for men ready to understand themselves beyond conditioning, and for women who want to better understand the men they love, work with, and raise. We're launching this e-course coming in March. Podcast listeners get $20 off with the code podcast. Patreon supporters, watch for your exclusive bigger discount before launch. So I was crashing out the other day about perimenopause and menopause. You guys might have seen it online because I was freaking out. It was like a moment of consciousness came upon me, and it hit me that, oh my gosh, nobody has really talked to me about this. This is as big as puberty. And it's just like hush, hush. And we hear whisperings of hot flashes here and there or mood swings here and there. But I guess I didn't realize that perimenopause, menopause, it's not something that I just get through and then I get to be the same person that I am now. Like, you don't get through it. You evolve into something new. Much like with puberty, you're not the young kid that you were anymore. You have all these hormonal changes and you evolve into something new and different. And you don't go back. You don't go back to not having boobs. You don't go back to not having a period, like when you're, in that sense of like the adolescent sense, right? So puberty isn't something just to get through, like it's a new arrival. And I think that I just didn't realize that that was the same with perimenopause, menopause. And it made me angry. Like I was getting so angry about it. So we're going to talk about it because this is stupid. Like I cannot believe that this is the world we live in. The year of our Lord, 2026. How are we not talking about what 100% of biologically born women will go through in their lifetime?
Yeah, you'd think that physicians at least would be having conversations with like annual physicals and stuff.
You would think, but we're going to get into it because I am riled up. Riled.
Yeah, absolutely. I can hypothetically think what that would feel like. I don't really know what that would feel like, but that seems like I'd be pretty upset.
But like, imagine what that would feel like. Oh gosh, how do I
I feel like I'm not me anymore.
Like, imagine living in a body your whole life.
Okay.
37 years so far.
Yeah.
And just now recognizing that you have a huge transition ahead of you. And you've been living in this body. And other people have been living in similar bodies. And no one's been talking to you about it.
Yeah, I'd be really pissed.
So I think a lot of what I am like referring to and referencing when I'm getting worked up about this stuff is perimenopause, which is the transitional phase before menopause, when estrogen and progesterone levels begin fluctuating, which often causes irregular cycles and a wide range of physical and emotional symptoms. It can start as early as your late 30s and typically last several years until menstruation stops. However, it can last like 2 to 10 plus years. There's a very wide range. Because menopause is when you've had 12 consecutive months of not having a period. That's when you're menopausal.
Okay.
Before that, though, is the perimenopause part, which can be a really, really long time.
Kind of like if you spin a top on a table and it starts to wobble before it stops moving.
Yeah.
The perimenopause is the wobble.
Perimenopause is the wobble.
Got it.
And puberty and perimenopause are physiological mirror events mean, they're just as, like, they're equivalently big in how they change your body and your hormones. They're both hormonal driven transitions that rewire the brain, metabolism, and your emotions. Now, people online were telling me I was fear mongering when I was freaking out. Some of them were. Like, a couple people made that comment. And I'm like, fear mongering? I am scared. Like, I'm not trying to monger fear, but I am sharing my own.
Yeah.
And also, people need to know about this.
Yeah.
And unlike puberty, there's no social scaffolding for it. Meaning that we don't provide any social support, let alone medical support, which we'll get into, but social support when we're going through this. Why I think this happens is modern culture glorifies women as youthful and fertile and like sexual, and menopause signals things going kind of in the opposite direction. Also, usually perimenopause and menopausal women will express how they really come into their own as far as being assertive or not giving any F's anymore about things, which is very against the patriarchy because we are supposed to be compliant. We are supposed to give the most F's about things. And where puberty talk is celebrated, like you're becoming a woman,
right?
Menopause is super privatized. We just don't talk about it because it's like the opposite of being fertile, which is what is glorified in our culture. It's treated like a decline instead of an evolution, where puberty is like an evolution versus menopause is treated like or perimenopause, menopause is treated like a decline.
You're so right. You're so right with that. Whoa. How astute to put it that way.
Yeah, and puberty has rituals, we have education and like support systems, we have awkward school programs. And it's because reproduction serves the species and the economy, and menopause ends that fertility. It doesn't produce anything useful by patriarchal standards. So no one built in rights for it or community transitions around it. And I'm talking in Western societies, because there are non-Western societies and indigenous cultures that do have social scaffolding. And menopause is honored as the passage into wisdom.
What it reminds me of, in obviously a very different way, but one of the core things about patriarchy and how it harms men is its emphasis on production. Men are valued because of our production. Financial production, physical production, reproduction, right? Mm-hmm. And when men are too old, where now you are on a fixed retirement income, you're not producing finances anymore. You can't produce necessarily with your body anymore. I mean, technically you could reproduce, but then there's issues with, performance and stuff because you're older. The way that you're valued drops off. But for women, this happens in an even more intense way decades earlier, because women are valued by what you can produce, which is children.
I agree, but disagree. I do agree that women are valued because of what they produce and the children thing, and now you can't, so you're not really counted as being useful because you were a vessel. Mm-hmm. But men do retain their fertility. Now, granted, I know you said that, but older men are valued in our society as knowing more, being wise. Experience elevates men. It doesn't do the same for women.
100% agree. That's a really good point. I do have a follow-up question. But is there an age where that drop-off happens? Like, is a man who's 70 with wisdom to share valued the same as a man who's 80 or 85 or 90?
I think as you cognitively decline, that there is.
There it is. That. You're right. You're totally right. It is when the cognitive decline happens.
But that doesn't.
Whoa.
Yeah.
So I am valued until my mind doesn't work as it should anymore.
Yeah, I think so.
But you lose value way before then.
When my uterus doesn't work like it should.
Your uterus, but also like the other ways that you're supposed to produce, because producing children, producing arousal in men is another thing.
Yeah.
Like there's all types of production focused. Not like patriarchy gives humans, men and women, instrumental value versus intrinsic, inherent value.
Mm-hmm. Yeah. That was good, some good points. That's interesting.
Yeah, just food for thought.
So we have no education on this, and I started thinking to myself, well, where would we get this education? I mean, obviously through the grapevine would be nice at least.
You're not in school like you were for puberty.
Yes. But I thought to myself, well, shouldn't school cover this? Like, shouldn't it, like, this is part of...
Oh.
This is like, do you know what I'm saying?
It doesn't?
No.
Are you freaking serious?
No, because sex ed is built around fertility, not female bodies or lifespan biology.
Oh, lifespan biology. That is a good phrase. I feel like it should be that.
Yes, but it's not about that. So when sex education and medical curriculum were standardized in the mid-20th century, the people writing them were male policymakers and physicians who were focused on preventing pregnancy, not teaching what happens after fertility ends. And women's health in general is framed around reproduction, from puberty to pregnancy. And the world, patriarchy, treats the female body as relevant only while it can reproduce. And then women, when they go through, quote unquote, the change, right, end up becoming invisible. It's invisible. Older women become invisible. It's a thing.
Yeah.
So menopause isn't considered public health. It's treated as a private medical issue that you go through. Dang. And because society sexualizes youth, it sidelines older women. So talking openly about menopause means confronting the fact that you're aging, that you've lost fertility, that female sexuality is changing, which is just not something that we like to talk about because it's all stigmatized.
Yeah.
Also, the excuse of it not being age appropriate became an excuse that sex ed typically ends in high school long before menopause is relevant to students.
Yeah, but when else are you going to learn about it?
Exactly. When else are you going to learn about it?
You know, and that really stinks because that is education standards are state by state.
Mm-hmm.
So you could have states that start adopting this in their sex education or just health class.
Mm-hmm.
And then you're going to have a ton of states that might just choose not to. And then it's just, well, it depends what state you live in.
And the thing is not to center men about this, but it does impact men. Do you know that you're married to someone who's about to go through a huge hormonal shift that's going to change their entire body probably?
I think men just kind of know, oh, hot flashes?
Well, that's basically what women know too. Oh, hot flashes?
Yeah, hot flashes, no period.
Yeah.
Very just limited insight.
I don't want to fearmonger, but we're going to talk about the symptoms of perimenopause.
Mm-hmm. I got scared for a second, like I was going to try and diagnose myself. And I had to remember, oh, I'm a man. That's the fear I just had when you said that.
Thank God. Thank God. Because we're going to go from head to toe. Uh-huh. And this is not all encompassing. I'm sure there are symptoms that I am missing. Mm-hmm. But here are some symptoms. Not every woman is going to experience every one of these symptoms, but these are symptoms that can occur due to the hormonal changes in your body. This can start to happen in your mid to late 30s, and it can last until you become menopausal, which is 12 months after your last period. And then some of the changes are permanent. It's just how they are because you don't ever get your estrogen and progesterone back and stuff like that to the other levels.
What if you do hormone replacement therapy, do you?
It relieves a lot of these symptoms, but no, you'll never, your body's not going to produce
it. Well, yeah, it won't
it.
naturally do it. Yeah, that's true. Yeah.
So brain fog, poor concentration, short-term memory loss. You have moments of not remembering things.
Is this way worse if you have ADHD?
Yeah, we're going to get to that too.
Okay.
Because I get a special dose, apparently.
Oh.
Mood swings, anxiety, new or worsening depression, irritability, headaches, migraines. Sleep fragmentation, night sweats, electric shock or zapping sensations, sudden jolts in your head or limbs, burning tongue or mouth.
What?
Now, can you imagine if men went through this?
This is extreme stuff.
Yeah.
And random stuff I never would have thought of.
Linked to reduced oral blood flow and dry mucosa. You get you dry up a little bit. So you get dry skin, you get your salivary glands don't produce as much saliva. It can cause decline in dental health, cotton mouth, burning mouth sensation, ringing of the ears, itching of the ears, sudden dizziness or vertigo, altered smell or metallic taste in your mouth, increased light sensitivity or visual shimmering, word finding problems or tip of the tongue moments, dry eyes, changes in tear quality. And then in menopause, those cognitive complaints often improve a little bit for many after the transition, but can persist for some. But the ongoing poor sleep or mood disorders drive lasting problems a lot of times. Skin becomes drier, thinner, less elastic. You have more itching. You can have crawling or prickly skin sensations, itchy scalp or shins, sudden acne, weird bruising or slower healing, rashes or eczema that appear out of nowhere. Your hair thins on the scalp. You can get new facial hair. Nails become brittle. Some report gum changes or bleeding gums. The nasal mucosa dries out, causing chronic stuffiness, nosebleeds, postnasal drip sensations. This is part of where there's like menopause, there's like a term called menopause allergies or new sinus sensitivities appear. In menopause, these changes often continue or progress because of the lower estrogen. Your skin ages faster and hair thinning may be permanent. Cardiovascular nervous system issues, heart palpitations or fluttering, adrenaline surges at night, body temperature instability, feeling hot 1 minute, freezing the other minute, having hot flashes, transient blood pressure, high blood pressure readings, shortness of breath is not a classic menopause symptom, perimenopause symptom, but the panic and anxiety caused by the hot flashes can cause the breathlessness. Bloating that moves around your torso, new food sensitivities, constipation, IBS-like symptoms, sugar cravings, sudden blood sugar crashes, abdominal weight gain despite lifestyle changes, fluctuating appetites. Perimenopause symptoms can mimic thyroid disease, including fatigue, stiff hands or menopause arthritis, tingling in fingers or toes, joint pain, restless legs at night, foot pain, collapsing arches of your feet.
Whoa.
Accelerated bone loss. So at menopause, you have accelerated bone loss and it raises your fracture risks. Your bone health needs attention with like calcium, vitamin D, weight-bearing exercises, and bone density monitoring. Reproductive health. Vaginal dryness, less lubrication, discomfort during sex, urinary urgency or frequency, recurrent UTIs, periods become irregular, heavier or lighter, burning vulva or labial shrinkage. Both the labia majora and labia minora shrink and lose fat and elasticity. So the skin thins and becomes lighter in color or more easily irritated. The clitoral hood can stick or fuse slightly if dryness is severe. Local estrogen cream can help with that, but that can happen. Vaginal spasms, breast tenderness, fullness, fluctuating size with hormonal swings. Lower estrogen changes the vaginal pH and microbiome, making yeast or bacterial overgrowth more likely unless treated with topical estrogen. In menopause, the breast tissue becomes less dense over time. Routine breast screenings is important still, but usually in menopause, you still have your vaginal atrophy. If that happens, that's permanent. Flare-ups of autoimmune conditions, new allergies, longer recovery from infections or injuries, sudden anxiety or panic out of nowhere, rage episodes or irritability, noise sensitivity or startle reflexes, depersonalization or feeling detached, crying spells without clear reasons, insomnia, frequent waking, trouble falling asleep due to hot flashes, anxiety, or restless legs, voice deepening or raspiness, body odor change, tooth pain or shifting bite because your jawbone loses or alters alignment.
What?
Twitching eyelids, hair texture can change to wiry or coarse, sudden intolerance to alcohol. So depending on how symptoms are defined, between 80 and 90% of women experience noticeable perimenopause symptoms. About 75% of women experience hot flashes. 40 to 60% can expect to experience sleep disturbance. Mood changes or new anxiety or depression happens to about 25 to 50% of people. Cognitive issues, about 40% of people. Vaginal changes, about 40 to 60% of the people. Joint pain, fatigue, or body aches, about 30 to 50% of people. So we're talking about tons of people that are just living with this. Now, emerging research has shown that neurodivergent women often experience perimenopause earlier and more severely. ADHD women show high symptom scores starting in their late 30s. Hormone fluctuations worsen executive dysfunction, mood swings, and sensory overload. Autistic women report more intense physical and emotional reactions earlier. Neurodivergent brains are more sensitive to hormonal change, so perimenopause can feel like an amplified version of itself, like it's more amplified. A population-based study found women with ADHD have substantially higher perimenopause symptom burdens. Differences peak at age 35 to 39, suggesting onset up to 10 years earlier than the average person. Same paper notes roughly 1/3 of ADHD diagnosed women have severe ADHD symptoms that are caused by this hormonal shift that show up between the ages of 35 to 39 and 40 to 44. A survey of 1,500 plus women showed that 94% reported ADHD symptoms worsened in perimenopause and menopause. Brain fog and overwhelm described as life-altering in their 40s and 50s. But what is the state of the research? Where are we at with this? How concerned are we about this?
Can I ask a question?
What?
So, menopause, you're menopausal when you have 12 months, no period. Right. Are you just menopausal the rest of your life, or does menopause end at
No,
you're
post-menopause.
So, I get perimenopause. So, what's the difference between menopause and postmenopausal then? When do you move from one to the other?
Menopause is just the title that you get when you stop having periods for 12 months. Mm-hmm. And then after that, you're postmenopausal.
So menopause is like an event.
From my understanding, perimenopause is when your hormones start to fluctuate, your periods can become irregular, and then you are officially menopausal after 12 months of no period. And then from that point forward, you are considered post-menopause. And post-menopausal is a long-term low estrogen state that follows, where hot flashes may ease, but you have bone loss, the vaginal atrophy, your cardiovascular risks increase. You have higher chances of heart attack and things like that.
Dang.
So where's the research on this? Well, lucky for us, in 2023, NIH decided to make menopause a special category for funding. So we finally get our own category for funding for menopause in 2023. Before that, menopause-related research didn't exist as its own defined category. It was scattered across studies on aging and women's health and bone health and cardiometabolic disease, etc. So that means that the NIH didn't historically track menopause funding as a separate bucket like it does for cancer, diabetes, or prostate cancer. In 2023, the NIH spent around $56 million on menopause research. I'm going to put this in perspective for you real quick here. So $56 million for menopause research. Remember, 100% of biological females are going to experience menopause. The best current estimate is that about 1 in 8 men will be diagnosed with prostate cancer at some point in their life, which is roughly about 12 to 13% of men. NIH has averaged spending roughly $270 million per year, about 5 times the dedicated menopause allocation, just on prostate cancer research. About 1 in 4 men, about 24% of men, meet the criteria for erectile dysfunction. NIH tracked ED-related research funding that they funded, like NIH specifically funded, was about $20 million in 2023. Okay, so yes, menopause was more than that, but you got to think about the life change difference there. I mean, not saying that ED isn't a serious thing for men, because it is, but we're talking about this whole body system.
Right, we're not getting zaps.
Yes, right. Right.
Jaw problems and all this crazy stuff.
However, ED, as far as like a year-to-year funding goes for research, billions in private research and development goes on around ED. To make matters worse, there was an infamous study done called the Women's Health Initiative. It was a hormone therapy study published in 2002. It was one of the most influential and most misinterpreted clinical trials in modern medicine. It changed how millions of women and doctors approached menopause. But it was designed terribly. They studied it in too old participants, meaning that the average participant was 63 years old, and they started doing hormone replacement at 63 years old on average. And they showed that it increased breast cancer risk and heart attack risk. Although the numbers were tiny, it was exaggerated on a global panic level. The problem is that when you are 63 years old and you are postmenopausal, you are going to have already had cardiovascular damage. And so now you're introducing hormones, you're causing problems. They also used outdated hormone types, not the types that we use today. And they ignored the timing hypothesis, meaning that starting earlier is actually, they found, safer and protective. If you start hormones earlier during perimenopause, or within 10 years of menopause, that made a huge difference when it came to health outcomes. So the fallout from this study was hormone prescriptions dropped 80% within a year.
Oh my gosh.
Millions abruptly stopped treatment. There was a huge surge in hip fractures, heart issues, and just poor quality of life. And then medical education froze on menopause for decades. Eventually, there were some subsequent studies that came out that confirmed women who start estrogen within 10 years of menopause had actually reduced coronary artery plaque progression. They had no increase in breast cancer risk, and they had improved bone, cognitive, and quality of life outcomes. Finally, in 2025, I think it was November of 2025, the FDA removed the black box warning on hormonal therapy. And guidelines now emphasize individualized treatment and how it's safe for most women under 60 or within 10 years of menopause. But it took a long time to get there, and a lot of testimony and a lot of pushing to get there. That one study really messed up menopause for a while. And you kind of alluded to this too, I think, a little bit, is about the doctor's knowledge on it. Shouldn't the doctors kind of know?
Yeah.
Right? Surveys show most U.S. medical schools provide 0 to 2 formal lectures on menopause.
Just lectures.
Yes, 0 to 2. A national survey of OBGYN residency programs, so you're specializing in women's health, OBGYN, right? Found that only about 31% of them reported having any structured menopause curriculum, period. When OBGYN residents themselves were surveyed, only about 20.8% reported their program had a menopause curriculum. Internal medicine and family medicine residencies fared no better. They often devoted only 1 to 2 hours total to menopause across the entirety of their training. Fewer than 1 in 10 residents felt well prepared to manage menopausal symptoms or long-term risks associated with menopause. There is no national requirement across U.S. medical schools or residency programs that mandates a specific number of menopause education hours.
That's a problem.
Continuing education is where most doctors learn about menopause. They have to seek it out and do continuing education. Jeez. Again, I just want to, as a man, can you imagine facing those symptoms down the barrel?
Yeah, I was thinking down the barrel of a gun.
Just facing them. They're coming for you. I don't know which ones I'm going to get. I don't know what it's going to be like. But you know what? It doesn't sound like the research really knows very much about it, and doctors don't really know very much about it either.
I feel so livid about the injustice of it.
Yes. It's angering.
Yeah, you don't care about me at all.
I knew that, but I feel that.
Mm-hmm.
On an even deeper level now. I have, since I've posted my rants, I've had people in my life come up to me and talk to me about it. And I had an older lady come up to me and said, I just want you to know that your generation is talking about it the most. You guys are getting the most education. Not as in a, you should feel lucky for that kind of thing. but kind of like as a, I knew nothing. At least you know something. At least you know it's coming.
So at least you know it's coming.
Yeah, like that it's
they
not
even know
just
it was a
like,
thing?
because she said the only thing that she was ever told was that there's a change.
Oh my gosh. Oh my gosh.
That there's a change. I have a friend, chronic health conditions, like so bad. And she has been going through it for the last couple of years. Exploratory surgeries, like a lot of like intestinal issues, things like that. Guess what? Menopause. They were all menopause symptoms.
Oh my God.
Nobody connected the dots.
Exploratory
she
surgery.
had multiple surgeries only to discover that she needed hormone replacement therapy.
Oh my gosh. And you have people opening her up and doing exploratory surgery.
Yeah, because she was having such bad IBS, Crohn type symptoms. She was like unable to function. Mm-hmm. And she's doing so much better now.
Good.
But I mean, years. She was going through this for like the last 2 years.
Dude.
Only to find out that it was like all menopause or all perimenopause symptoms. And I don't know what doctor put that together finally, but she had been to so many specialists about it.
And no one thought to raise the question.
Yeah, but how would you think to raise the question if you've had 0 to 2 lectures on it in your entire life?
Yeah. Yeah, you're right.
Like, that's not what's coming to your mind. So if you're going to an immune specialist or you're going to a GI specialist or I guess the closest that you could get to maybe somebody, OBGYN, but her symptoms were mostly GI symptoms. And she was having allergic reactions to like everything.
Oh, yeah, you mentioned that in the list.
Yeah. So it was all like GI focused and like autoimmune focused.
Yeah.
If the symptoms themselves aren't completely debilitating, trying to get help for these symptoms can sometimes cause more trouble.
Yeah.
Yeah. So anyways, that's why I was so worked up, and I'm still worked up about it. And I don't know how to fix it, and I don't know what to do about it except for talk about it. And that's when it dawned on me how powerful influencers really are, because in some of these things, that's the only way you're getting education. There's a really famous menopause influencer. Her name is Dr. Mary Claire. I know there's some other phenomenal influencers out there. There's some great podcasts out there as well. I think Dr. Mary Claire has a podcast, if I'm not mistaken. There's a podcast called Menopause. And just multiple influencers out there that are talking about this, that are raising awareness, that are helping so many women. But I think it dawned on me, like, wow, how powerful influencers, I guess, can be. Because I don't think about influencers being influential in that way, I guess.
Yeah, in the education way.
Yeah, as I'm on an education platform.
Well, that's why I think, I would classify them as content creators, maybe, more than an influencer.
Yeah.
Because your content is something that's more, at least for me, when I think content creator, I think of something of substance that you are bringing to the masses. Influencer sounds like, oh, you promote products, or you have brand deals, or like more like popular culture stuff. Yeah.
But still, with a content creator, I don't think about, I realize that we raise awareness and that, like, I think that we do good. And I'm not saying that. But when I look at like the menopause, like this very niche thing here, I just think to myself, like, if there wasn't voices like Dr. Mary Claire and like other people out there, there would be nowhere, like, where do you even go?
Yeah.
Like, you can't go to your doctor. Yeah. You can't go to the research. You can't,
Yeah. I hope for those of you listening, something was intriguing or sparked a curiosity, or you felt affirmed or challenged. Stay educated. Take the pink pill. If you enjoyed this podcast, please give us a follow and maybe a nice review.